Alrighty, welcome back to the Big Show. I'm Jamel Hartman. It's the Daily Hour brought to you by the BAC Group of Companies, Medical Wells, Lindos, and People's Pharmacy. Do not forget to subscribe on our website, thedailyhour.com. Follow us on all of our social media channels to stay up to date with all that we have going on. Help us grow beyond the mic as we do our part to continue to improve our community. Without further ado, let's give a warm TDH welcome to our guest for the day. We've got Daniel Kavanagh coming on, and we're talking about mental health and some research that he did on Bermuda's young people. Let's give him a warm TDH welcome. Welcome. How are you, sir?
Good, thank you. It's good to be here.
Thank you for coming. Our audience gets a bit excited. They're cheering for you like they know you, but they'll know a lot more about you after this. But thanks for joining them. All right, let's jump right into it. Tell the audience a bit about yourself, your background, and what it is that you do.
Sure. So I'm a high school teacher from Australia. And after I was teaching in Australia psychology for a few years, I moved to Russia. And when I was in Russia, I studied psychology. And I studied specifically something called mental health literacy, where I was exploring the mental health literacy of Russians and Australians. And after 3 very long winters in Russia, I decided to have a bit of a sea change. And so I moved to Bermuda. And when I was in Bermuda, this was in 2019, so just before the world ended, I started noticing that there was a lot of things going on with the students that I was teaching at Warwick Academy. So big shout out to my Warwick Academy students from the past. I noticed that there was one thing that they didn't really feel comfortable talking about mental health problems with an adult. And coming from Russia, I thought there would be less stigma in Bermuda. So I didn't really know anything about mental health or what that looks like in Bermuda. And so I basically wanted to explore that. So as soon as the pandemic hit and we saw this big increase in mental health problems, I went around to all the schools, all the mental health professionals in the island. And I said, look, I'm happy to make this my PhD research if I know that there's community support for this type of research to happen and understand what's going on.
I want to go back to your move. That's a big move from Russia to Bermuda. So, and you know, anyone that comes into our small community, we welcome them and we thank them for bringing such intellect. And I wanted to ask you, you just started mentioning you conducted the first ever national mental health survey of adolescents. Speak more to us about why this was your focus.
Absolutely. So I approached this initially from a teaching perspective. I noticed the students in my room, particularly during the pandemic, during my homeroom, during my classes, that I wasn't able to support them in the way that I usually felt that I could, trying to go between remote learning on and off, seeing the distress that caused on the students themselves and families. I wanted to use research, this extra experience that I had outside of teaching, to try and address this problem. So initially, the idea was simply to just do something at Warwick Academy. But then after speaking with so many other teachers, so many other schools, with mental health professionals on the island, I realized that because Bermuda is such a small population, we've never actually done a national mental health study on adolescents before. And yet it's clear that there is a problem, in that the last 30 years around the world, we've seen an increase in mental health problems amongst young people. We didn't have any local data. So that was basically my what I was tasked with. Is I said to everyone, all the principals and the Ministry of Health and Ministry of Education, I said, I will happily do this research as long as I have support to help us understand what's going on, so that myself and a classroom teacher, I would have better guidance, but then also all the other teachers would also have better guidance. As a community, we'd have better guidance about what we actually should be doing to try and address this problem.
Yeah, you said something key, that Bermuda didn't have this data. And I know on this show in particular, one of the things that our audience is always speaking about is that we don't do a good job of collecting important data, simple things like how many Bermudians have left the island. So doing something like this with mental health is incredibly important, especially in young people. So thank you for taking this up. Can you explain why is it so important for us to address mental health at an early age?
Absolutely. So all the research shows from around the world that if you can address adolescence, so if you can address mental health in adolescence, you're doing what's called early intervention, or even better, you're doing prevention work. And prevention work is always better than cure. It's better for the individual themselves because they spend less time being so distressed. It's better for the families of those individuals who have to basically support that child or that adolescent. And then it also means that in the future, they're going to be healthier as well. So if we wait until into their adolescents, get into their 20s and 30s, before we actually double down and try and provide the support they need, that means we're going to be trying to solve the problem, things like depressants or more psychologists through service. And absolutely, those things are important, particularly having the right levels of support. But it's a far more expensive way to try and address this issue. I think we're trying to build a better, healthier, happier community. Then we've got to look at our adolescents and we've got to provide them with the support that they need to grow and become their best selves, rather than waiting till there's a problem, letting it develop, and then trying to throw all these resources at fixing this problem that could have been solved with a little bit more foresight and attention towards prevention.
Indeed. Thank you for that. And audience, if you have any questions or comments for Mr. Kavanagh, please send them through. We'll get through as many questions and comments as possible. Speaking of that, the prevention measures, what resources are needed to ensure that young people have access to mental health care?
Yeah, so let's make an important distinction between prevention and service provision. So when I start to talk about prevention, I mean, we're trying to prevent these problems from happening at all. If we're talking about providing the right type of support for young people, so that could be school counselors, it could be psychologists and psychiatrists when they become more extreme, then those are the types of things that you think about. But we want to take, holistic approaches to improving this problem. So it's not just having a one-off workshop with some kids about mental health literacy, or it's not having a one-off session with staff, but it's, can we redesign the way that our schools look so that they are more welcoming or youth-friendly? Even the services that we provide to students, are they in buildings that are youth-friendly, or the services themselves, such as providing counseling? Maybe not every 12, 13, 14-year-old wants to go into a room and talk about their problems. So can we do more things like animal-assisted therapy or logotherapy or art therapy? There are different ways that we can provide support. And I think with this research, we're exploring more of those ways that we can provide students in meaningful ways.
Indeed, indeed. We've got some questions coming through, but you'll be discussing the groundbreaking results, the results of your groundbreaking research, sorry. But what surprised you most about what you learned during your research?
Yeah, it's a really good question. I would have to say that, so what we had seen in the past 30 years is we'd seen this increase in mental health problems amongst youth. We then saw on top of that the pandemic doubled the reporting of these symptoms. And then when we actually came out with our results, we found that our averages in Bermuda were 5 to 6% higher than global averages. So we see this sort of decreasing, pandemic decrease again, and then Bermuda, I'm seeing higher than those averages as well. So for me, what that showed was that, okay, we definitely have something we need to talk about. This is something we should not be ignoring. This is not something that we can just deal with later, because as we've already explained, it gets worse or harder later. Like, it is much better that we address this problem head on right now and throw some resources at it, because otherwise it will get more problematic. Arguably, the most surprising statistic after that was that not only do we have this, 31% of adolescents reporting these symptoms of depression and anxiety, and 31% reporting these symptoms of depression, and 25% reporting these symptoms of anxiety. Only 30% of those students reporting those symptoms actually had the intention to seek help. And when you compare that data to the drug survey data that happens every 4 years, those numbers look more realistic, like 10% in the last 12 months as an adolescent sought help. So we have these students that are distressed and they're not seeking help, the vast majority.
Wow. Let's go to Instagram. We've got a comment. Mia Chambray is asking, do you think cell phones are causing a mental health crisis among adolescents? Yeah, what was the cause? No, let me say, before you answer that, audience, I'm not asking particular questions today, because there's going to be a lecture taking place where he's going to share a lot of the information of his study. And there's no point in discussing it all today if the intent is to get people to the study. So I'm not going to ask specific questions. So I am okay if he says, you know what, we'll speak about more of this at the lecture. And I'm okay with that, sir.
Wonderful. So I will reiterate that as well. If this is something that you're interested in, please do come to Bermuda College tomorrow. We have a great cross section of the community coming to attend from 6 p.m. It is a public town hall event. It's open, it's free, so anyone can come. You don't have to RSVP, but we will be going into a lot of detail about all kinds of questions that you might have about mental health. So please do come along. But to answer that question about social media, we did have this question asked on Thursday night when we did our first town hall event at Summersfield Academy. Social media is, of course, one of the big things that everyone is talking about. So cell phones, and specifically the devices that we can use or the applications we can use on them, like social media, it is something that is causing people a lot of concern. And I definitely think we need better regulations around social media use in adolescence. What that looks like is something we have to agree on as a community to decide, because if one school or one parent says, okay, we're not going to allow students until the age of 14 to have cell phones or 14 to access social media. And these types of things, by the way, are happening in Australia. This is a big election, turning into a big election year in Australia. And they're talking about, things like banning cell phones or increasing the age limit on social media. So these are genuine things that we need to talk about. But to use that word cause, is the cell phone usage causing these problems? I haven't seen the data to say that is the outcome. The way that I think about cell phones, social media, is that they amplify existing problems in a community or society. So if we're in a totally healthy, happy, integrated, connected community, these cell phones would just be a part of life that would bring a little bit of extra benefit. They wouldn't divide us in the way that they can, or increase the symptoms of distress in young people by themselves. So I think better regulations around specifically any sort of self-harming or violent content on social media. I think we need better restrictions and resources there. But that's not because I think they're causing the distress symptoms. I just think that's good policy and that's good regulation. And I think more research is needed to really deeply answer that question.
Gotcha. All right, let's go to the audience. Teray Tall, she's asking, did you find a gender dynamic in your mental health findings, particularly as young men are becoming increasingly radicalized?
Yeah, I think we do a pretty good job, actually, of. Well, I mean, I spend a lot of time with Dr. Ernest Peets at the moment, because he comes on our town halls, and he obviously talks a lot to adolescent mental health, specifically boys, or providing services to men. So let's just clarify our findings in the research, and then I'll say if we should go in one direction or another. We found that females were twice as more likely to experience these symptoms of depression, and again, more likely to experience these symptoms of anxiety. So it was 40% were reporting these symptoms of depression of females, so 2 out of 5, and then only 1 out of 5 for males. That's not to say that males don't represent their distress in other ways, and they can become radicalized in other ways. But that's not what we saw in our data. Interestingly, what we tend to find is that males also seek help less for their problems. And we found this very strange, almost bizarre, very confusing result that we talked about a lot, which was that adolescent boys actually indicated they were more likely to seek help for a mental health problem, which is something that really surprised us and isn't what you usually see around the world. And so we actually went, again, back to the Department of Drug Control, and we looked at their data that specifically looked at, had someone actually sought help in the past 12 months for an emotional behavioral problem. And we found that, as expected, boys did actually seek help. So it's like there's a confidence that they feel in asking for help, but then probably to do with stigma, they don't actually seek help. So we do absolutely need to improve the ways that adolescent boys can receive care and can ask for help, so that we can avoid this radicalization.
Indeed. Maya Palacio is asking, when did the research take place? How many students/schools were involved?
Yeah, so the reason we call it a national study is because we had every eligible school participate. There were 15 schools at the time that could participate. So those were all the private schools, all the public schools, and we got them all to participate. We had 2,716 students sent to the survey, which accounts for about 76% of the population attending adolescent population attending middle and high school. And I do want to thank the likes of Commissioner Richards, of David Kendall, who were incredibly supportive from both the Department of Education and the Department of Health in making sure that we could work with public schools to also be included, because initially we had started with the private schools, and then we were thrilled that we were able to get both all the private and public schools.
Indeed. We've got Rosalind Famous asking, how many subjects were in your study?
So just to reiterate, we had 2,716
2,700?
2,716 participants. Those students are sent to the survey. So say yes, I'm happy to provide my data.
Can I, and someone asked gendered, what's the racial breakdown in children? And did you notice any difference based on race? Did you notice any difference based on public versus private? Any data? Again, feel free to say you can tune into the, because I don't want to take away from the lecture.
No, that's fine. I can't speak to any differences between private and public. We didn't report those findings because this is an issue that affects everyone, and it's not significantly worse in private schools or public schools. So I can speak to the racial differences. We did explore those. So we found that those who identified as of a minority race, meaning they identified as mixed, Portuguese, Asian Pacific Islander, or other, they had the highest symptoms of anxiety and depression. And then with regards to those that identified as Black, they had high symptoms of depression, but not anxiety. So basically, white and Black adolescents had the same level of anxiety symptoms. Black adolescents had more than white adolescent symptoms of depression, and then minority had the overall most out of all those groups.
Interesting. Thank you so much for that. Just remind people, when does this event take place? You said it's free. It's tomorrow. Time, exact room if you know, but we need to get people out to this. And will it be streamed? That's the other important thing, because a lot of people may not have access.
Yeah, absolutely. So it is at Bermuda College. There are flyers that we will be sending around. So I'll if I can share them with you, Jamal, and you can send them out to your listeners, then that would be wonderful. It starts at 6 p.m. and it goes till 8 p.m. So we will make sure there is a signage so that people know where to go when they come in. The first 30 minutes is essentially us discussing everything about all the research that I'm talking about now. So the key findings, as well as our plan for discussing how we actually approach addressing the solutions, I should say. So as the research team, we've developed a proposed youth mental health plan. So these are the 11 recommendations that we think should be acted upon in the next 3 years, so that when we do the survey again in 2027, in October 2027, we can see that there's a measured result. And then the last 90 minutes is all question and answer. And basically every town hall that we've done so far, we have run out of time because we didn't have enough time to answer everybody's questions. But this will be the biggest event that we have done. This will be, if you want to understand what are the priorities as a community we should be moving towards with regards to youth mental health, what are the key questions we need to discuss? Do you have any questions yourself that you'd like to ask? This is absolutely the time to come. We have Dr. Sandy De Silva, the Executive Director of the Family Centre, Dr. Ernest Peets, founder and therapist at Mask, Dr. Peter Yates, the child psychiatrist, and Dr. Shawnee Basin, who's my research supervisor. Shout out to you, Shawnee, who will all be on the panel discussing as local experts, what are the things that we need to be doing. So I think it'll be a very well attended event. You've got literally all the experts from the community there to answer your questions. And I think the reason why we need people to attend is that some of these things that we're going to talk about are about cause us to be a little bit introspective. The reality is that at the moment, at the age of 16, this is just as an example, at the age of 16, we allow our young people to drive on our roads. We allow them to choose their sexual partners. And yet, unless they're 18, they can't access any mental health services without their parents' permission. That's a question we've got to ask, is that how things should be in Bermuda? That's one of those legislative or policy changes that could be life-changing and life-saving. In the UK, it's 16 years of age. In Australia, it's even younger. So is this something that we want to talk about? And
Mm.
As a research team, we're going to be discussing this and saying, okay, what does the community think? And these are our thoughts.
Interesting. Real quickly, I'm not sure if you said or not. Is it going to be streamed for those who may not be able to make it?
Sorry, yes. So the hope is that it will be streamed. I better check with my associate in the Bermuda College just to confirm that will be the case. So
let us know. We'll share on the show tomorrow if it is.
Great, wonderful.
All right. Well, thank you so much for joining us. We definitely value this conversation and the work that you've done. We speak about mental health so often. I believe World Mental Health Day is October 10th, if I'm not mistaken. There's been a stigma around mental health in such a small community for so long. I've said it on this show before. I've said it publicly. Former Premier Dr. Ewart Brown was my mother's doctor. And when I was having challenges as a child, I had to go see child psychologists. I had, visits for anger management. And I always, as I became an adult, appreciated that my mother got me help at such a young age. When my fellow classmates would wonder why I was late to school, I wasn't ashamed to say where I went or why I went there. But I think it was shamed. It still is shamed in such a small community. And I will always say to my mother, like, she saved someone she saw something wrong with. And to any parent out there that may be experiencing challenges, get the help. You don't have to do it alone. So thank you for this, Daniel Kavanagh. I hope that we get a good audience out tomorrow. And please know that this show, anything else that comes up, important data and information, please use us as a vehicle to express it to Bermuda. Talk to you soon.
Thanks for having me.
Have a great one. Bye-bye. All right, Daniel Kavanagh, folks, if you appreciated the conversation, please give us a thumbs up, a love, a like. Make sure you share the conversation with your friends, your family, your colleagues. Make sure people have access to it. I value conversations like that. I truly do. I truly, truly do. I don't think we are over the hump when it comes to mental health in Bermuda. We're going to take a quick break. Stick with us. We'll be back in a minute, 25 seconds to wrap it up. Oh, and we've got a daily play for you.